Hello, namaste to everyone and wishing you all a very happy International Yoga Day. And this is Dr. Ankur Gulati practicing medicine for the last 12 years, and today I have got the privilege to share with you that how a practice of yoga can help you in managing your cardiovascular and metabolic disorders. Actually, this yogasana can become a powerful adjunct along with your other ongoing treatment to manage and actually reverse these cardiovascular and metabolic diseases. So let's understand in how many aspects this yogasana can help us. So the first aspect is the metabolic symphony, the insulin resistance and the glycemic control. So when we talk about the diabetes, we are really concerned about the insulin resistance at the cellular level. And the years and decades of research and evidence has proved that the yogasanas and the practice of yogasana and pranayams helps in controlling the insulin resistance. Basically, they enhance the uptake of the glucose in the skeletal muscles by augmenting the GLUT4 translocation into the muscle cell membrane, and basically this helps in the insulin resistance. Yogasanas can basically down-regulate the pro-inflammatory cytokines like TNF-alpha and IL-6 that impair the insulin signaling. And this yogasana also elevates the adiponectin levels, which actually increases the insulin sensitivity in the cell muscle. Also, we have as a proof a 2018 meta-analysis on diabetic medication which showed a HbA1c reduction by 0.6% in a person who was practicing yogasana for regularly 12 weeks, and that is comparable with adding a second oral anti-diabetic agent. So you can see the benefit of the yogasana. The second positive effect of yogasana is the autonomic balance, which is a positive key step in the blood pressure reduction. So hypertension often reflects as an overactive sympathetic nervous system. So when a person is practicing yogasana with slow diaphragmatic breathing exercises and vagal tone practices, basically this yogasana shifts the autonomic balance. So ultimately this yogasana can decrease the sympathetic activity by decreasing the heart rate and decreasing the vasoconstriction, and it actually increases the parasympathetic activity, which increases the baroreceptor sensitivity, and ultimately it releases more of nitric oxide, which helps in blood pressure reduction. So for clinical evidence, if we talk in a stage 1 hypertension patient who practices daily 15 minutes of yogasana including yoga practices and pranayam, it can actually decrease your systolic blood pressure by 8 mm of Hg and the same diastolic blood pressure by 5 mm of Hg. And this is considered equivalent to adding a single drug, a monotherapy of antihypertensive medicine like an ACE inhibitors. And another important third benefit of practicing yogasana is the reduction in the lipid weight and improvement in the endothelial health. Basically, this regular practice of yogasana and the pranayams and the breathing exercise can actually reduce your LDL cholesterol and the bad triglyceride cholesterol, and can actually increase the HDL, the good cholesterol, by 5%. So the basic problem in the weight and the lipid metabolism is the visceral fat. Many yogasanas are there, but the one and the most important yogasana is the Surya Namaskar, which involves 12 steps of the yogasana, and basically it can incorporate, and it actually incorporates the large muscles of your body, actually helps in the reduction of the body weight and helps in the improvement of the lipids also. Endothelial health is also improved by doing the isometric holds in the exercises and the yogasana of Utthit Trikona Asana, in which the endothelial nitric oxide is released, which again improves the endothelial health and can actually improve your blood pressure. If a person is regularly following this yogasana along with a good dietary habit, you can actually reduce your arterial stiffness, thereby improving your cardiovascular health. As you are well aware, the comorbidities in your body are to be targeted very effectively if you are going to treat this hypertension, diabetes and the ischemic heart disease and the neurovascular disorders. So these comorbidities are very well managed with these yogasanas, like the non-alcoholic fatty liver disease. When you are practicing these yogasanas regularly, liver can basically reduce the storage of extra fat in the liver actually, and it also regress this non-alcoholic fatty liver disease. Also, it can increase and improve your mental health. It will improve your sound sleep by using melatonin and regulating the cortisol rhythm. And ultimately this healthy yogasana can improve and decrease your heart disease, your brain stroke, your paralysis and your much more diseases which are waiting to be happening in your body with these ongoing comorbidities and the metabolic syndrome like diabetic retinopathy, which is the worst case scenario which any patient should see. So now the most difficult and the most important question arises: how can we implement this healthy yogasana into a very busy schedule which is ongoing with all of the person in this modern era? So from the clinic to the mat, this is a very important discussion. Basically, you have to start and you have to stick with your regime. You have to start with 20 minutes a day yoga asana and only 5 times a week with your busy schedule. And basically, you can start with a mix of simple exercises and pranayams, and you can customize this as per your flexibility of the body, as per your age, as per your musculoskeleton and your orthopedic diseases. Also, the important thing is to monitor your blood pressure and glucose levels at regular intervals and HbA1c every 3 to 4 months to see what beneficial effects you are seeing on your body, so that you can encourage others also to involve in this yoga. Finally, to conclude, I would request that if you are a caregiver, if you are a clinician, if you are a patient, if you are a healthy patient, if you are a healthy person, I request you to do not think that yogasana is only for the disease. As I told you earlier, the yogasana, the yoga practices is a preventive rather than a therapeutic effect. But this has a therapeutic effect also if combined with ongoing diseases and with the diet control. So it's the time that we have to prescribe each and every of our patient yogasana simple practices that we can and everyone can follow at his or her home, and that can actually improve the outcome of the disease and the ongoing treatment. So today on this International Yoga Day, I take the pledge and I request you to just follow this yogasana and just advise all of your patients, the young and the elder one, to practice as much and as comfortably they can follow, and just take the benefit of this yogasana, and do not consider this that this is only a practice that has to be done, and this is an evidence-based practice nowadays, and that has been accepted internationally also. So we have to follow this, and we have to definitely advise this to each and every of our patient for the healthy outcome of the disease. So on this yoga day, I take the pledge to follow this and advise you, and I sign off. Tata.